Hello, everybody. Welcome back to HeartBrief. I'm Joel Kahn, medical doctor, preventive cardiologist, triple board certified, and clinical professor of medicine. So let's look at some top stories in the past week in the medical literature that have meaning for your practice and mine. And some of these are just all over the world in terms of headlines. So let's pick the first one in the journal PLOS Medicine. Association between cigarette smoking status, intensity, and cessation duration with long-term incidence of 9 cardiovascular or mortality outcomes. This was a collaboration of major medical centers across the United States that all contributed epidemiologic data. They were able to look at 22 cohort studies looking at whether a person was a smoker or not, how much they smoked, how many years they smoked, when they quit, and what happened to them in terms of outcome. What they found that made headlines all over with a follow-up of between 14 and 20 years. So it was pretty long duration follow-up knowing a smoking history was really quite amazing. If you look in the abstract, the key sentence is compared with never smokers. Participants with 2 to 5 cigarettes per day demonstrated substantially elevated cardiovascular risks, with a hazard ratio ranging from 1.26 for atrial fibrillation, 1.57 for congestive heart failure, 1.57 for cardiovascular disease mortality, and shockingly, just 2 to 5 cigarettes a day increased all-cause mortality as observed in the study with a hazard ratio of 1.6, a 60% increase. Now, if you smoke 11 to 15 cigarettes per day, the numbers were much higher. So it all made sense and tracked the volume of smoking. And their conclusion was lower intensity smoking is associated with cardiovascular risk, and primary public health messages for current smokers should be early cessation rather than reducing. It must be cessation. Cessation provides substantial immediate risk reduction. So, we've all heard of smoking for years and years and years in cancer world, cardiovascular world, general health world. But when we were queried about the question, how about 2 cigarettes a day? You'd probably say, well, it's a lot better than 20. It is, but it's not 0, and 0 is the only answer. So, a fascinating piece of data. Talk to all your patients about smoking. I have them read a book, Alan Carr's book of Quitting Smoking. Very powerful book that's been around for over 20 years and millions of copies sold. So I find it very helpful with my patients. All right, let's go to another topic that fits just before Thanksgiving in terms of whether we should be eating all the turkey or not, okay? I'm exposing my bias, of course. And this paper was published in Scientific Reports, again, just in the past 7 to 10 days out of Korea. Association of plant-based diet indices with all-cause and cause-specific mortality among Korean adults in KNHANES. I don't know how to pronounce that, but it's the equivalent of what we have in the United States called NHANES, but this is the Korean version. Between 2007 and 2015, 44,000 people filled out dietary questionnaires. Their diet was judged to be an all plant food diet and then broken down into a healthy plant food diet or an unhealthy plant food diet. And then there was the group that did not eat all plant foods, of course. And these people were followed for a median of 8 years, during which, of these original 44,000 people, 2,300 died. For all-cause mortality, any cause of death, the hazard ratio for a plant diet index that was high was 0.77, a 23% reduction in all-cause mortality for any kind of plant diet index. But when you looked at a healthy plant diet index, there was a big difference compared to the unhealthy plant diet index. We all know that beans are not Skittles. They both are plant-based. Beans would fall into the healthy plant diet index, and Skittles would fall into the unhealthy plant diet index. When they looked at not just all-cause mortality, but they narrowed in on cardiovascular disease mortality, The hazard ratio for a plant diet was zero point 0.6, a 40% reduction in death during the period of this study. Quite remarkable. 8 years, 40% reduction for the plant diet eaters. But the unhealthy plant diet eaters did not benefit. You cannot go buy a frozen pizza that says plant-based in the grocery store. You can't necessarily come out with some sort of McDonald's or Arby's variation in a bag and call that a healthy plant diet. So the conclusion of this study, adherence to an overall plant diet index and a healthy plant diet index were associated with a lower risk of all-cause and cardiovascular disease mortality, while an unhealthy plant diet index was associated with a higher risk. So this is an interesting study. It adds on to so many others that properly done, a plant diet is very healthy and may be associated with less risk of death during the period of study, less risk of cardiovascular disease and death during the period of study. So it fits in with the Loma Linda long-term studies, the EPIC studies out of Europe and others. And it gives us reason to say maybe on Thanksgiving, we are reaching more for the sweet potato and the cranberry sauce than we are necessarily reaching for a turkey slice after turkey slice after turkey slice. The decision is yours, and the message you give your patients is yours. Okay, we are going to go to the last paper, and this is the big one. I've saved the big one to the end. This is the one that's going to generate lots of controversy. I believe I've got it. Yes. The Journal of Nutrition, Health, and Aging. Publication date is actually January 2026, but there it is. It's available. Association between high protein intake and cardiovascular disease by age groups, a cohort study. So this again was a database study. This was using the UK Biobank dietary questionnaires from 2007 to 2023. What was the definition of a high protein diet based on these questionnaires? More, listen up, more than 1.8 grams per kilogram per day. Remember, the US government talks about 0.8 grams per kilogram per day as a goal. I've read data that the average American eats more like 1.2 grams per kilogram per day. But some people are listening to online medical doctors and other people that consider themselves nutrition experts, and they're not taking those USDA guidelines, 0.8 gram per kilogram per day. They're doubling and tripling them. And this study looked at those that were more than double the USDA recommendations. The primary outcome was major adverse cardiovascular events, strokes, heart attack, bypass, stents, and death. So there were 19,000 people in this study, average age 54. During the period of follow-up, a number of them had cardiovascular events. What did they find? They found that high protein intake, and it was largely animal protein, not necessarily soybeans, had a higher risk of major adverse cardiac events compared with low protein intake. The hazard ratio was 1.21, so 21% higher. But a high protein diet, greater than 1.8 grams per kilogram per day, was also associated with a higher risk of all-cause mortality, heart failure, myocardial infarction, and cardiovascular disease death. Now, one of the pre-specified points in this very important study, cohort study, observational study, there will not be a randomized study like this that goes on for 5 to 7 years. It just won't happen. So it's part of the approach to nutrition science is to include epidemiology studies, cohort studies, was that if you were over age 55, the high protein group was strongly associated with a higher risk of major adverse cardiac events. In the group younger than age 55, the relationship was not significant. And they concluded higher protein intake was related to incidence of major adverse cardiovascular events in participants over age 55. Now, in the discussion, they do go through how this data is consistent, the 13-year follow-up of these 19,000 people, with other studies that have previously been reported, and that's of interest, and I recommend you find the paper and read it. They also talked about, potential pathways by which their observation might be true. They talked about higher levels of inflammation and oxidative stress with a high protein diet, higher branched chain amino acids like methionine and leucine that have previously been associated with shortened lifespan in other studies. They even talked about more constipation in people eating a high protein diet, slower elimination of toxins in the bowel. They talked about higher risk of insulin like growth factor 1 and maybe precipitating cancers. They talked about the metabolite TMAO, which goes up with red meat. And you certainly could add pesticides, herbicides, hormones used in raising animal foods, new 5GC. And now we know that 1 million people in America or such have a red meat allergy after being bitten by the Lone Star tick. So there's all kinds of possibilities, although this was a UK biobank study, and I not read yet that the Lone Star tick is in the UK, but it's over half of the United States. That's another topic we covered in the previous episode of HeartBrief. So these three papers are very, very interesting. I hope you found them of relevance to what you talk about with your patients in terms of nutrition and lifestyle and prevention and delay of cardiovascular death and all-cause death, what we call health span. There's a lot of discussion now about lifespan, health span. Some people are using the term muscle span. How much of your life can you keep your muscles healthy? I use the term heart span. How much of your life can you keep your heart healthy? And I think these papers give us some insight how we can use these information on HeartBrief to improve our heart span. So you're welcome to use that term. I've not patented it, but I don't know anybody else using it. I just think it's relevant. Thank you very much. It's Thanksgiving weekend. I hope everybody makes good choices, is safe, and we'll see you for the next episode of HeartBrief.